Colorectal cancer awareness. According to the American Cancer Society, more than 1 million people in the United States count themselves as survivors. While early detection and treatments make a difference, there is more that can be done. Knowing the causes and risk factors help prevent colorectal cancer. What is colorectal cancer? Colorectal cancer starts in the colon or the rectum. These cancers can also be called colon cancer or rectal cancer depending on where they start. Colon cancer and rectal cancer are often grouped together because they have many features in common. The colon and rectum. The colon and rectum make up the large intestine or large bowel, which is part of the digestive system, also called gastrointestinal system. Most of the large intestine is made up of the colon, a muscular tube about 5 feet long. Colorectal cancer risk factors. A risk factor is anything that raises your chance of getting a disease such as cancer. Different cancers have different risk factors. Some risk factors, like smoking, can be changed. Others, like a person's age or family history, can't be changed. Being overweight or obese. If you are overweight or obese, very overweight, your risk of developing and dying from colorectal cancer is higher because overweight raises the risk of colon and rectal cancer in both men and women, but the link seems to be stronger in men. Getting to and staying at a healthy weight may help lower your risk. Colorectal cancer risk factors you can change. Not being physically active. If you're not physically active, you have a greater chance of developing colon cancer. Regular, moderate to vigorous physical activity can help lower your risk. Colorectal cancer risk factors you can change. Certain types of diets. A diet that's high in red meats, such as beef, pork, lamb, or liver, and processed meats like hot dogs and some luncheon meats raises your colorectal cancer risk. Colorectal cancer risk factors you can change. People who have smoked tobacco for a long time are more likely than non-smokers to develop and die from colorectal cancer. Smoking is a well-known cause of lung cancer, but it's linked to a lot of other cancers too. Colorectal cancer risk factors you can change. Alcohol use. Colorectal cancer has been linked to moderate to heavy alcohol use. Even light to moderate alcohol intake has been associated with some risk. It is best not to drink alcohol. If people do drink alcohol, they should have no more than 2 drinks a day for men and 1 drink a day for women. This could have many health benefits, including a lower risk of many kinds of cancers. Prevention. Colorectal cancer screening. Screening is the process of looking for cancer or precancer in people who have no symptoms of the disease. Regular colorectal cancer screenings is one of the most powerful tools for preventing colorectal cancer. Prevention. Body weight, physical activity, and diet. Weight, being overweight or obese, increases the risk of colorectal cancer in both men and women, but the link seems to be stronger in men. Physical activity. Being more active lowers your risk of colorectal cancer and polyps. Diet. Overall, Diets that are high in vegetables, fruits, and whole grains and low in red and processed meats probably lower colorectal cancer risk, although it's not exactly clear which factors are important. Not smoking. Long-term smoking is linked to an increased risk of colorectal cancer as well as many other cancers and health problems. Quitting smoking may help lower your risk of colorectal cancer and many other types of cancer too. If you smoke and would like help quitting, call the American Cancer Society at 1-800-227-2345. Vitamins, calcium, and magnesium. Some studies suggest that taking a daily multivitamin containing folic acid or folate may lower colorectal cancer risk, but not all studies have found this. In fact, some studies have hinted that folic acid might help existing tumors grow. More research is needed in this area. Non-steroidal anti-inflammatory drugs. Many studies have found that people who regularly take aspirin or other non-steroidal anti-inflammatory drugs such as ibuprofen, which is Motrin or Advil, and naproxen, which is Aleve, have a lower risk of colorectal cancer and polyps. Hormone replacement therapy for women. Some studies have shown that taking estrogen and progesterone after menopause, sometimes called menopausal hormone therapy or combined hormone replacement therapy, may reduce a woman's risk of developing colorectal cancer, but other studies have not.